Whenever you encounter unfamiliar bumps on your skin, it can be stressful. You might ask yourself questions such as, are the bumps dangerous? Will they go away? What caused these bumps to begin? Welcome back to MKGI Skincare, where glow that matters. What is keratosis pilaris? Keratosis pilaris is a common, harmless skin condition that causes small, hard bumps on your skin around clogged hair follicles. Your skin may look like it has goosebumps and feel rough like sandpaper. You may have heard it called chicken skin. The bumps are usually the same colour as your skin, but they may look red or white on light skin and white, brown, or black on darker skin, or they may not be discoloured at all. They don't hurt but may. It's not clear why keratin builds up in people with keratosis pilaris. It might happen along with a genetic disease or skin conditions such as atopic dermatitis. Dry skin tends to make keratosis pilaris worse. However, since the bumps are linked to the buildup of dead skin cells, you can help treat them and prevent others from forming with regular exfoliation. Dermabrasion and chemical peels from a dermatologist can also help in more severe cases. Dry, less humid times of the year can contribute to the development of these bumps. Regular exfoliation can still help, along with keeping your skin hydrated with lotion. While the bumps may feel dry and rough to the touch, keratosis pilaris is not itchy. Most like acne, keratosis pilaris is a lot more common around puberty. Often, it gets better as a person grows older. It also tends to come and go. It usually gets worse in winter. Keratosis pilaris is genetic, so if you have it, chances are a family member has it too or had it when they were younger. It's not an infection though, and it's not contagious. Keratosis pilaris is not a health problem. Although it doesn't hurt or itch, some people feel embarrassed about it. You probably notice it more than other people do. Some factors that increase a person's chances of developing keratosis pilaris include a family history of the issue, generally dry skin, hay fever, ichthyosis vulgaris, a condition that causes dry skin, eczema, atopic dermatitis, obesity or overweight, Down syndrome. Keratosis pilaris is the most common cause of arm bumps, but it isn't the only possible cause. It isn't usually itchy, but some other types of arm bumps can be. If the bumps on your arms are itchy, then consider the possible causes below. Itchy causes. Some bumps on the arms can be itchy, in part because of inflammation and irritation in the skin. Possible causes of itchy bumps that may develop on the arms include eczema. This inflammatory skin condition can cause a red itchy rash that may be raised in some areas. Hives. These are red bumps that develop from an allergic reaction. Folliculitis. In folliculitis, inflamed hair follicles cause multiple bumps on the skin. Heat rash. Heat rash is caused by excessive heat and results in clogged sweat in your pores. Psoriasis. Psoriasis is an inflammatory skin condition in which excessive skin cell growth leads to notable red to silvery skin patch. Diagnosing bumps on the arms. Knowing what keratosis pilaris looks like can help you determine whether your arm bumps are related to it or to another common condition. A doctor can also diagnose the bumps on your arms with a physical exam. Since there are numerous possible causes of skin bumps, it's important to get the correct diagnosis so you can properly treat them. In some cases, you may be referred to a dermatologist for diagnosis and treatment. This is especially true if your primary care doctor suspects an inflammatory skin condition such as eczema or psoriasis. If the cause of your arm bumps isn't quite clear, a dermatologist may conduct a biopsy, especially useful in ruling out skin cancers. A biopsy involves scraping off a small amount of the skin bump and studying it under a microscope. How to treat bumps on the arms. Treatment options for bumps on arms will depend on the cause. Therefore, getting an accurate diagnosis is key to getting the right treatment. At-home remedies. If keratosis pilaris is the cause, treatment is not needed since the condition is harmless. However, it's understandable if you want the bumps to go away for appearance sake. You may be able to treat the bumps on your arms at home. Below are some simple home remedies to use a mild moisturizer several times during the day. Use a mild, non-soap cleanser on your arms in the shower. Avoid hot showers or baths. Using a urea or lactic acid moisturizer may help treat skin bumps and relieve dryness. According to the American Academy of Dermatology Association, apply the moisturizer directly on the bumpy areas of skin within 5 minutes of showering or bathing, or at least 2 to 3 times a day. Exfoliation. The process of removing dead skin cells from the top layer of skin may also to help relieve the bumpiness. For this, you can use a loofah or microdermabrasion kit. Laser therapy. Speak to a healthcare provider if treating the bumps at home isn't working. If bumps persist despite moisturizers or medications, a healthcare provider may recommend a more targeted treatment such as laser or light therapy. Laser treatment may reduce swelling, redness, and discoloration and improve your skin's texture. Medication. A healthcare provider may also recommend a medication to help improve the appearance of bumpy skin. These medications often include a type of acid, retinol, or urea. Research has found that using acids such as salicylic acid or glycolic acid may improve the appearance of keratosis pilaris. Follow a healthcare provider's instructions on how often and for how long to use a medication. Stop using it if your skin gets irritated. Hydrocortisone cream is available without a prescription and may soothe many rashes. Stronger hydrocortisone or other steroid creams are available with a prescription. If you have eczema, apply moisturizers over your skin. Try oatmeal bath products, available at drugstores, to relieve symptoms of eczema or psoriasis. Oral antihistamines may help relieve itchy. How long does it take bumps on arms to go away? It may take time and trying different treatment options for the bumps to go away. Remember that treatment is optional. Bumps on the arms usually are harmless. Usually, the bumps will disappear over time. Even without treatment, it's important to see a healthcare provider, such as a dermatologist, for skin changes that are new or worsening. However, Keratosis Pilaris is very common and harmless and usually not a need to worry. If you're concerned about the appearance of bumps on your arms and home remedies like consistently moisturizing isn't helping, speak to a healthcare provider about other treatment options. In addition, if you notice a worsening appearance of bumps on your arms, or if your symptoms change, reach out to a healthcare provider to determine the cause. In many cases, bumps on the arms result from keratosis pilaris, a benign condition that usually requires no treatment. Certain home care techniques can help reduce the bumps and any associated symptoms. A doctor can recommend professional treatments if these methods are ineffective and the bumps. For more exclusive videos, click subscribe and push the notifications bell. Thank you guys for watching, and see you again in our next episode.